We can make incredible improvements in American health care, but I don't think having more government, in effect putting Washington between you and your doctor, is the way to go. What we ought to be dealing with are things like litigation reform, things like wellness programs. That's one thing I think we can all agree on. The CEO of Safeway is a very impressive man that we've all heard from, who's been able to bring the health care cost of his company dramatically down by emphasizing things like obesity control, eliminating smoking to the maximum extent possible, high cholesterol, high blood pressure, more exercise. There are a number of things we can do to improve our healthcare system.
Let me just start with a couple of things that you've said here. The President's people will tell you that he is not proposing any kind of a rationing board. They would also say to you that when he's proposing a public insurance option, that is just to give people another option if they don't want to go, that if they want to keep their private insurance, that's okay, and that it's not going to crowd any of that out. So
I know they say that, Bob, but in fact, if the government is in the insurance business, there won't be any other insurers. It's inevitable because the taxpayers will be backing up the program. We've seen a kind of version of that over in the auto takeover. You've got Ford Motor Company, which makes Ford vehicles in my hometown. It didn't take any government money. Now having to compete with a government-controlled General Motors Acceptance Corporation, trying to finance their cars in competition with a government financing company, and they're having a hard time doing it. So we know that if the government gets in this business, pretty soon nobody else will be in the business.
Is that a deal breaker for you and for Republicans? Because he seems to be insisting that this public option, which would be very much like Medicare for older people now, this would be something where the government, you could opt for that rather than private insurance. Yeah. But is that a deal breaker as far as you're concerned? I think that for virtually every Republican, a government plan is a non-starter.
There are a whole lot of other things we can agree to do on a bipartisan basis that will dramatically improve our system. But we already have the best health care in the world. We know it costs a lot, but we have the best health care in the world. And I don't think many Americans want to start having to wait in line, start getting government permission for procedures. We need to be very careful about taking the wrong steps.